Good morning. Today we will be seeing experimental epidemiology. Before going into experimental epidemiology, we'll have a small introduction on general epidemiology. Epidemiology is the basic science of preventive and social medicine. It is a branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. The word epidemiology is derived from the Greek word epidemic. Epi means upon, logos means people. Sorry, logos means science, and demos means people. The formal beginning of epidemiology can be attributed to the findings by John Snow on the epidemic cholera in London in August 1854. As a pioneer in the field of epidemiology, John Snow is considered as the father of epidemiology. Coming to the definition, there are a lot of definitions for epidemiology available in the social media or net. But the most popular epidemiology definition is given by John M. Last. According to John M. Last, epidemiology is the study of distribution and determinants of health-related states or events in specified population and the application of this study to control of health problems. The epidemiological studies can be broadly classified into observational studies and experimental studies. The observational studies can again classified into descriptive studies and analytical studies. In descriptive studies, a hypothesis will be formulated, and that hypothesis will be tested in analytical studies, and by experimental study, we will prove the hypothesis. Coming to experimental epidemiology. Experimental epidemiology or experimental studies involve some actions, intervention, or manipulation such as deliberate application or withdrawal of suspected cause or changing one variable in the causative chain in the experimental group while making no change in the control group and observing and comparing the outcome of experiment in both groups. This contrasts sharply with the observational studies where the epidemiologists take no action but only observe the natural cause of event or outcome. The experimental studies have all the advantages and disadvantages of cohort studies and three additional problems such as cost, ethics, and feasibility. Coming to the goals, the experimental epidemiology provide a scientific proof of etiological factors which may permit the modification or control of those diseases. It also provides a method of measuring effectiveness and efficiency of health services for the prevention, control, and treatment of diseases and improve the health of the community. Coming to the types of experimental studies, there are two types: randomized controlled trial and non-randomized controlled trial. The main difference is in randomized controlled trial, there is a process called randomization. But in non-randomized controlled trial, there is no randomization. Coming to randomized controlled trial, the basic steps in randomized controlled trial are drawing up a protocol, selecting reference and experimental population, randomization, manipulation or intervention, follow-up, and assessment of outcome. The first step is drawing up a protocol. The protocol is nothing but a written document of the study. It specifies the aim and objectives of the study, questions to be answered, criteria for the selection of study and control groups, size of the sample, procedures for allocation of subjects into study and control groups, treatment to be applied, when, where, and how, to what kind of patients, standardization of working procedures and schedules, as well as responsibilities of the parties involved in the trial up to the stage of evaluation of outcome of the study. A protocol is essential especially when a number of centers are participating in the trial. Once a protocol has been evolved, it should be strictly adhered throughout the study. Sometimes, before a protocol is completed, a pilot or preliminary study has to be made to find out the feasibility or operational efficiency or certain procedures or unknown factors, or the protocol should be agreed upon by all the concerned before the trial begins. So it is better to do a pilot study before preparing a protocol. Next step is selecting reference and experimental population. First is the reference population, which can be also called as target population. It is the population to which the final findings of the trial, if successful, are accepted to be applicable. The reference population may be the mankind itself, or can be limited to a geographical area, or limited to a specific age, sex, occupation, or social group. Next is experimental population or study population. The study population is derived from the reference population. It is the actual population that participate in the experimental study, and it is important to choose a stable population whose cooperation is assured to avoid loss to follow-up. Next step is randomization, which is the most important step in randomized control trial. Randomization is a statistical procedure by which the participants are allocated into groups, usually called as study or control groups, or to receive or not to receive an experimental, preventive, or therapeutical procedure or intervention. Randomization is an attempt to eliminate bias and allow for comparability. In randomization, every individual gets an equal chance of being allocated into either group or any of the trial groups. Randomization is done only after the participant has entered the study, that is, after having been qualified for trial and has been given his informed consent to participate in the study. Next is manipulation. It involves the deliberate application or withdrawal or reduction of the suspected causal factor. The manipulation creates an independent variable whose effect is then determined by the measurement of the final outcome, which constitute the dependent variable. Next is follow-up. This implies the examination of the experimental and control group subjects at defined interval of time in a standardized manner with equal intensity under the same given circumstances in the same time frame till the final assessment of the outcome. Thus, follow-up may be short or may require many years depending upon the study undertaken. Next is the final step, that is the assessment of outcome. Here we will be getting both positive and negative results. The positive result is the benefit of the experimental measure, such as the reduced incidence or severity of the disease or other appropriate outcome in the study and control group. Negative result, it includes the severity and frequency of side effects and complications, if any, including death. The incidence of positive and negative results is vigorously compared in both groups, and the difference, if any, are tested for statistical significance. Based on this, we will decide whether the study is successful or is a failure. Blinding techniques. A bias may arise from the error of assessment of outcome due to human elements. These may be bias from the part of participant, may be a observer bias, or maybe bias from evaluation. So these bias can be removed using blinding technique. There are 3 blinding techniques. First is single blind trial, second is a double blind trial, and third one is triple blind trial. The first we'll see the single blind trial. The trial is so planned that the participant is not aware whether he belongs to the study group or control group. The second is double blind trial. In the double blind trial it is so planned that either the doctor nor the participant is aware of the group allocated and treatment received. Third one is triple blind trial. This goes one step further. The participant, the investigator, and the person analyzing the data are all blind. Ideally, of course, the triple blinding should be used, but double blinding is the more frequently used method when a blind trial is conducted. Some types of study designs. There are mainly 2 types of study design. First one is concurrent parallel design. The comparison are made between 2 randomly assigned groups, one exposed to the specific treatment and other not exposed. The patient remain in the same study group till the end of the investigation. That is either the study group or in the control group. Crossover type of design. Each patient serves as his own control in this type. The patients are assigned randomly into study or control group, while the study group receives the treatment under consideration. The control groups receives alternative treatment or a placebo. These 2 groups are observed for a certain period of time, and then the patients in each group are taken off of their medication for a certain period of time. Then the group are switched. Those who are receiving the treatment are changed into control group, and those who are in the control group will come to treatment group, and the study will be continued. There are certain types of randomized control trials. That includes clinical trials, preventive trials, risk factor trials, community trials, cessation experiment, trials of etiological events, evaluation of health services. Now comes the non-randomized control trials. Non-randomized control trials may not always be randomized control trials may not always be possible to carry out due to ethical reasons or administrative or other reasons. Example, smoking and lung cancer and induction of cancer by virus cannot be experimented in humans. Also, some studies required a long time and will be expensive because of disease frequency is low and natural history is long. Then non-randomized control trials are performed. Few examples of non-randomized control trials are uncontrolled trial and natural experiment. Uncontrolled trials may be useful in evaluating whether a specific therapy appear to have any value in a particular disease, or to determine an appropriate dosage, and also to determine the investigation and to determine the adverse reactions of an of a medicine. Natural experiment can be done where experimental studies are not possible to human population. In these situations, the epidemiologist seeks to identify natural circumstances that mimic a experiment. Coming to the conclusion, every disease has certain weak points susceptible to attack. The basic approach is to in controlling disease is to identify these weak points and break the weakest link in the causation of transmission. It can be done with the help of epidemiology. As Forrest observed, an epidemiological investigation is more than the collection of established facts. It includes the orderly arrangement into chains of interference with extent or more or less beyond the bounds of direct observation. Thank you.